Okay, so it is my pleasure to introduce Arvette Reid today on a topic that I cannot believe we have not covered. But as been out there looking at it, not I haven't really found anybody doing discussions on the topic of senior living contracts. And it's so surprising to me because I would say on a weekly basis, I have somebody sort of questioning, I'm looking at this senior living community, but they want a down payment or an entry fee payment or all of that. There's a lot of confusion about contracts and entry fees and things of that nature. And we're going to do our very best to tackle this today. And I'm going to give both of us a free pass here because Arvette, I think you put together this presentation special for us today, right? So,
yeah.
So we're going to do our best to answer any and all questions, but if we can't answer them, we'll follow up, or I expect us to have a follow-up discussion to this on any sort of segments or details that we get a lot of questions on. But before we dive into this, Arvette, let's get to know you a little bit better. Tell everybody a little bit about your background. I've known you for years, and you are very well equipped to talk about this because of your interesting career path.
Yeah, no, thank you so much, Steve, for having me. And it's hard to believe that you and I just had a quick chat about this and couldn't believe that no one had done it. So I'm so excited that we were able to put this together today. So for those of you that don't know me, my name is Arvette Reid, and I spent 15 years working in the senior housing and healthcare industry here in Northern Virginia. So I'm in Alexandria, born and raised, grew up actually knowing several people that lived at Goodwin House, Alexandria as a child. And after 10 years in software where I got burnt out, I decided to go back to Goodwin House. And that's what started my 15-year journey of working in this industry, which I love so much. So I worked independent living, assisted living, dementia care, nursing care, and hospice care, all of which I was in marketing and admissions, working directly with families who were trying to make decisions. And the other thing is I was always the one that had to tell you how much something cost or whether or not it was going to be covered by insurance. So I felt like I was always delivering the bad news that the financial professionals never told you. So 5 years ago, I actually joined SEIA, which is a wealth management firm, and I work for a partner named Tom West. Tom West has always been in this space of helping seniors in post-retirement years figure out how to pay for housing and healthcare. So he asked me to join so that we could figure out a way to take the gap between healthcare and finances and figure out how we could get them more intersected so that families could be better informed in making these decisions. So talking about contracts is not something that I did as a professional within senior housing and healthcare only. I also do it in the job I do now in finances and helping people understand how these contracts work. So hopefully I'll be able to answer it at a high level, and then we can get more specific in the Q&A.
I love it. And the questions are already coming in, and that's what I love. I mean, that's what gets me charged up the mornings that we have these discussions. I can't wait to hear and see the questions that come in. So Arvette, you've got a slide deck that you're going to share. Go ahead and kick that off. I'm going to dive behind the curtain here, and feel free to shout out if you need my help. But folks, I know those who have been on some of our discussions, sometimes we'll take a break and we'll do a few questions throughout the discussion. Arvette and I talked about it this morning, and I think it's best if type in your questions or write down your questions to be answered. And Arvette is going to go through her whole slide deck, and then we will make sure that we tackle all the questions at the end, because this one in particular, we could start going down some rabbit holes and she may never get through all the points that she wants to make.
Right. All right. Thanks, Steve. Okay. So the first thing I'm going to start with is this crazy slide, right? And the reason I like to talk about it is because when you think about the senior housing and healthcare industry, there are so many options. And it can be very confusing for families that are in the midst of trying to make healthcare and housing decisions, right? So we're going to do our best to just narrow that down. So for today, the categories of senior living that we're going to discuss are the 55 and older active adult, independent living, assisted living, nursing and rehab, and life plan. And why I did it this way and put life plan at the end, because life plan is one of those big ones that people have a lot of questions about. But if you notice, the reason I have independent assisted nursing listed separately, because each of those can be its own thing, not within a life plan community. So let's get started. If you look at this graph on the left, you see that there's the cost, right? And then the bottom talks about the level of care and supervision. And so you can see as you go up to the right, the more help you need, the higher level of care and the higher the cost. This is the fundamental base of understanding how pricing and contracts works in the industry. So I'm going to say that again, and you can see it written on the screen. The more help you need, the higher the level of care, the higher the cost. Okay. All right. So quickly, on 55 and older, adult active community, independent living community, they all kind of fall in the same bucket. But basically, it's like a neighborhood of people of a certain age and above. And they're usually located near some kind of attraction. So you might find some that are near a golf course or some kind of, bike path or recreational activities. Sometimes they're located in a metropolitan area or right in the suburbs that has easy access to like the metro to get to the museum or a concert or whatever it is you might be interested in the arts. And then sometimes they're near a university campus. So that's really big with lifelong learning, right? So you'll find these active communities all over the place. But what I want you to understand, and from a structure standpoint for the presentation on the bottom right, you'll see the contract structure for these types of communities are really a real estate transaction. So you may be purchasing an apartment or a home, or you may be renting an apartment or a home. But really think of it as a real estate transaction. There's really usually some kind of real estate agent involved in this type of move. All right. So that's enough about the low end of the scale. So we've done 55, we've done independent. We're now going to spend a majority of our time on this space. And this is where we typically call the long-term care services, assisted living, memory care, and nursing and rehab. A little bit about long-term care statistics. 70% chance of needing care after the age of 65. So if you are over the age of 65 right now, there's a 70% chance that you're going to need some kind of long-term care services, right? And long-term care services is still very broad. In today's world, we're just talking about living, but that also could include home care services and things like that, right? The other thing I want you to be aware of is that 3 years is the average number of years that people will actually need these services. So there's a 70% chance you're going to need it. And then when you need it, you're going to need it on an average of 3 years, right? So this is really important when you're thinking about what you're going to do down the road, what you're going to plan for down the road, where you're going to live down the road. So it's not just understanding the contract structure, it's understanding how the structure can change as your care needs increase over time. We can't talk about contracts and payments without having a fundamental understanding of what Medicare is, right? So we know Medicare is a federal benefit that you can either qualify for or not qualify for. A majority of people in the United States qualify, right? Medicare, as you know, covers you going to the doctors, covers you going to the hospital. If you need hospice, it's covered by Medicare, or if you need to go to a skilled nursing home. What Medicare does not cover is long-term care spending, right? So let me repeat that. Medicare does not cover long-term care spending. So if you are needing to pay room and board at a high level of care, that is not something that your Medicare insurance is going to cover. I'm also briefly going to touch base on Medicaid, because there are people out there who'll say, oh, I'm just going to do Medicaid because they've heard about it through the church or their neighbor or their friend or whoever. But when you are considering Medicaid, there are 3 factors that you actually have to qualify for Medicaid, right? The number one is medical. There has to be a medical need. So just because you feel like you don't have enough money doesn't mean you can actually qualify for Medicaid. The second is income, which is what people think about. How much do you have coming in? Social Security, pension. And then resources is your house. And that's where usually people get in the conversation like, I want to keep my house. I don't want to lose my house. Well, Medicaid, how does Medicaid work? So Medicaid is a financial assistance program, and it is state run, and you have to apply. And when you apply, you have to meet all 3 of these criteria. So I wanted to get that out there now, because as we talk about these high levels of care and you see some of these costs, you need to know that Medicaid is not an option for everybody, okay? It's a great option for those that need it, but it is not an option for everyone. Here are some sample costs for the long-term care services that we talked about briefly. So assisted living, we tell people to budget $120,000 a year. Memory care, budget $145,000. And nursing, $180,000. Obviously, these are averages. I live in Northern Virginia, so the Northern Virginia pricing and the market here might be a little bit more than if you were in Oklahoma, for example. So, but I like to throw these numbers out so that you have a better understanding of what we're talking about as you age, as you need long-term care, and as you plan for those 3 years of services. So now let's jump into assisted living. Assisted living, and if you look on the right, the contract structure is monthly fee payment, right? So assisted livings charge you on a monthly fee. And we're talking about assisted livings on their own, not as part of the life plan. As a reminder, we're gonna do life plan later. So assisted livings, their monthly fee, it could be an all-inclusive rate. It could say $10,000 a month is your fee, and it covers this list of things. Some assisted livings prefer to go for the fee for service structure, which is you come in at maybe a level 1, and it could be how much help you need, what kind of help you need determines what level you are. And so some people would say, okay, mom can come into an assisted living as a level 1 or a level 2. And then as she ages and needs more help, you need to expect that that fee is going to go up, right? When you look at assisted livings, they all don't include the same thing in that daily rate, or in that monthly fee. So you need to make sure you understand what are the additional charges that you will have above and beyond whatever that monthly fee is. A good example of that is toiletries, or if someone is incontinent and you need adult diapers, that's not covered in the monthly fee. So just be prepared to understand that. Once someone moves in, and if you're on a fee for service, it's the nursing management that actually talks to you and says, it's time for us to level up, right? So you should expect, if you pick a fee for service, that you're going to have ongoing conversations. And at some point in time, levels of care are going to go up, which means your monthly fee is going to go up. The other thing you need to know, which is the last bullet, is sometimes even in assisted living with the 24-hour staff in the community, you still may be asked to pay for a private duty for a variety of reasons, right? It's not a given, but it does happen, and you need to be prepared for that. And it could be that your loved one is in a memory care community and is in an assisted living community and starting to have issues with cognitive impairment and memory. And so they would prefer that you hire a private duty just to make sure that they're getting what they need during the day, whether it's feeding, bathing, dressing. Not that the staff of the assisted living can't help, but sometimes people just need more one-on-one. Another example of one-on-one would be coming from the hospital. So say your loved one's at an assisted living, they're in the hospital, and they're coming back from the hospital. Sometimes an assisted living will say, hey, we would prefer that you purchase some private duty or some companion care just for a little bit to make sure that they get acclimated after that hospital stay. So I like to include that. So even though it's not in the contract, you need to be prepared that that might come up. Let's talk a little bit about the types of assisted livings. The first is the small assisted livings. People usually refer to them as the homes. They're single family homes, and they're in your neighborhood. Sometimes you don't even know they're there, but they're smaller environments for typically 3 to 7 residents. Sometimes they will specialize in hospice or specialize in dementia care. Sometimes they're just general, and they'll take anybody that needs assisted living. And then you have the assisted living bucket that most people are familiar with, which is a building, and that building can be a standalone, or it can be part of a larger community. It might, they might be a corporation that has many assisted livings around the country, or it could be a family owned that maybe just has one in your local town. And then lastly is memory care. And as you notice, we've gone higher. So as you go up, you need more care, more help, more cost. So memory care, as you saw on the previous slides, tends to be more expensive than assisted living because people who have cognitive impairment and need to be in a secure unit so they don't wander, they actually need a lot more help with medicines and bathing and queuing and all of those things, right? So those are the 3 buckets of assisted living that you will find people discussing. I'm going to now switch and we're going to go up an acuity level. We're going to go up a higher level to nursing. So nursing and rehab. Nursing and rehab is based on a daily rate. So remember, assisted living was a monthly rate. Nursing and rehab is a daily rate. And before I go any further, let me clarify. Nursing home is a building. The word nursing home still is there. It's a building. What happens inside the building is where the terminology can sometimes change, right? So it might be called a nursing center. They might call it nursing and rehab, whatever, but it's the same building. When you are in nursing and rehab, if you are there for short-term rehabilitation, short-term rehab, you are there for a designated amount of time, right? And that's what you hear people cover by Medicare, Medicaid, or your health insurance. And how that works is you typically have to have a 3-night stay in the hospital, which qualifies you to get rehab under one of those payer sources, right? And so when you are in the rehab facility, you can be getting speech therapy, you can be physical therapy, occupational therapy. You can also be getting nursing rehabilitation. So for example, let's say you had a stroke and now you just need some help with, or another example would be a wound, right? Where there's nursing things that need to happen that also happen along with your therapy, occupational, physical, or speech, right? So they all go together. That's rehab bucket. For those people that are in these buildings who are not under rehab, who the designated time has ended, right? So they are no longer with Medicare. Sorry, your skilled stay is over. If they are permanent residents of that building, of that nursing and rehab, they are paying private pay out of pocket or Medicaid. Those are the funding sources if you live there. So if you think way back in the day, generations ago, most people think of nursing communities as that, where their great grandmother lived or their neighbor lived, right? So those people were private paying or under Medicaid. Today, the business of nursing and rehab is really short-term rehab. So most of these communities, they really get people in and out, in and out, in and out. They don't have the business of running the full-time beds like they did back in the day. Now they have them, but that's why you see so much turnover in these nursing homes, because people's Medicare days and designated short-term rehab days are ending and they have to leave and they have to go somewhere else. So I hope that's clear. Daily rate. So we have now quickly gone through all of these as individual entities, right? Now let's talk a little bit about grouping. So this is a made up word, coupled senior living is what I call it. So there's been a trend over the years that instead of having standalone or life plan, that we're going to have these kind of coupled communities where they will have independent assisted and memory care, but they don't have nursing care. And so you can find all of that either in one building or on one campus. They're owned by one company. And so they can actually leverage staff among the different levels of care. But from a contract perspective, it's still silos. Like you're going to have a contract for independent living, you're going to have a different contract for assisted living and a different contract for memory care, right? But you do have the convenience of having them together. If you were a couple, and let's say you were a wife and your husband had Alzheimer's, and you were doing a great job of taking care of him at home, but then it became just a little bit too much. Something like this might be an option where he might need to go to memory care and you can go to independent living, but you could still be in the same building, right? So if you need 2 different levels of care, this is the opportunity where you actually don't have to fully separate and you have to drive and see your husband where he is. So now we're going to jump into like the big one that everybody really wants to understand, which is life plan communities. So life plan communities include independent, assisted, memory, and nursing. They include the full continuum of care. And that's what we're going to define as a life plan community. And the contract structure can be very complicated. And I'm going to do my best to go piece by piece for you. So life plan communities, let's look on the bottom right. The contract structure has two components. There's an entrance fee. Some people call it a buy-in fee. You'll hear that too. And a monthly fee. So two components, entrance fee and monthly fee. These life plan communities, the names have changed over time. So you might have heard of it as a CCRC, continuing care retirement community, or a life care community, but we're all talking about the same thing. When you talk about life plans communities, they are assuming that you are moving into independent living. Let's say that again. You are moving into independent living. The concept is you started independent living and then you move through the continuum of care, which is different in what we said in all the other scenarios where you could just go into an individual level of care. When you are in a life plan community, they offer the higher levels like I showed you, the assisted living, the memory care, the nursing rehab. Sometimes it's all in the same high rise, sometimes it's on the same campus, or sometimes it might be down the street, but close enough that they can call the life plan community. But you have to remember that the higher levels of care in these communities are typically reserved for the residents that live there in independent living. I'm going to say that again. For life plan communities, if you have a need for assisted living, memory care, or nursing, those beds, those rooms are typically reserved for residents that moved into independent living. They are not for the general public who might live down the street. All right. That's one of the benefits of going to a life plan community, people will say, is because they have easy access to the higher levels of care if they want it. The entrance fee and the monthly fee are based on the size of the living space you choose. So if you choose a studio apartment, those numbers will be lower than if you choose a 2-bedroom and den. All right. So when you get those price sheets from a life plan, you will see a long list of all the different apartments they have, the sizes they have, and then the price range. And in some cases, these life plan communities have cottages, right? So it's not just apartment buildings. They tend to be more apartment buildings here in this Fairfax County area. But if you look around the country, if you look down in Charlottesville, they have Westminster has places with cottages. So some people really like the idea of cottages, but they're still within a life plan contract. And the entrance fees may be refundable. So we're going to deep dive into what that means on another slide. But you have the entrance fee component and the monthly fee component. And when you do a life plan community, you have the option for that entrance fee to have a refundable clause in there. So I'll come back to that. Life plan contracts. This is a big one. Type A, Type C, and real estate transaction. So let's start with Type A. A Type A contract means when you move into independent living, whatever your monthly fee is, if you need a higher level of care, your current monthly fee stays the same. All right? Not the monthly fee. If you move in today and your monthly fee is $4,000, 5 years from now you move, you have to remember monthly fees are going to go up with inflation, just like everything else. Remember, monthly fees are going to go up. But at the current time you move from your independent living apartment to a higher level of care, your monthly fee stays the same. Type C is you pay a going rate. So if you move into independent living and then you need to move to assisted or nursing care, whatever the going rate is, that's the rate you're going to pay. So you're going to have to pay the increase, whatever that is. And then lastly, the real estate transaction. We have one of those here in Northern Virginia. Sometimes your independent living apartment, you're actually buying it or renting it, but you still have to pay the monthly fee in order to get the life care contract, right? So in all three of these cases, there's some kind of entrance fee or buy-in and a monthly fee. Your monthly fee will go up every year, just like inflation does, and the community will inform you on what that increase is, all right? The other thing about the entrance fees, the entrance fees on Type A communities tend to be slightly higher than the entrance fees on Type Cs. So entrance fees on Type A's tend to be higher than the ones on Type C's. And the reason is because the community is taking the risk of you needing more care. Because if you go from paying $4,000 a month and then you need to memory care, which is $12,000 a month, They're not asking you for that money because you're in a type A contract, right? They have to provide the services, however it's going to cost them. So that's why those interest fees tend to be higher. So the question when you look at type A, type C purchasing, what is your philosophy? If you prefer to pay a higher insurance premium, so you're covered no matter what happens, if you're the person for your car and your home insurance that likes to have those big policies that like, if anything happens, I don't have to do anything, it's covered, right? That might be you. Or you might be the person that says, I want to pay as I go, right? And I know if something happens to my car or something major happens to my house, I'm probably going to have to pay a lump sum of money to get that fixed, right? So this is how that translates into the contracts. So type A is more of a, I'm one of those people that just wants to pay it up front, and then when things happen, I don't have to worry about it. Or type C or real estate transaction is, you know what, I'm going to pay for what I need when I need it. And that's my belief. The reality is there is no right or wrong. It's a preference. So you will hear people give their argument about which one is better. The most important thing to me when I talk to clients, it's not about the contract structure per se, it's about the community. When you were looking for college or you had your kids and you were helping them look for college, you had to find a community that fit you, that was your vibe, your peeps, what you like to do, your activities. That's the same thing when you're looking at life plan communities. And then you look at the contract because the contract has options, right? So don't discount a community just because fundamentally you would rather be a type A or type C. You still need to do your look around and do your comparison. So let's talk a little bit about these entrance fees and when do I get the refund? So if you select a refundable entrance fee option, right? So if you accept that option, the refund goes to the person or persons designated in your move-in paperwork. And that's important. So you may have your legal documents, your estate planning documents that says, you know, your will, your trust, whatever. That's not anything to do with when you give money to a life plan community. There's a form when you move in that you will fill out that says who's supposed to get your refund when you die. And you can change that name at any time. But I just wanted to make sure we had that distinction. Also, in the world of refunds, you'll typically see that there's a 50% refund or a 90% refund. Lately, a lot of communities have been switching to an 80% refund. So I just want to let you know that there really are three options now, 50, 80, and 90, all right? Just different options for you to choose from and to compare. When you die, and it's time for your refund to go to whoever is designated on that piece of paper, some communities may require that the living space be reserved by another resident before they process your refund. That's not with everyone, but that is for some. So make sure when you're understanding how the refund policy works, that you know whether that apartment has to be rented or not. For an example, my father-in-law lived at a retirement home here in Northern Virginia. And he was in independent living and eventually had to move to memory care, right? When he passed away, he died in memory care. We were able to get on the list to get the refund. It didn't matter what had happened in independent living because he had already moved out. The contrary to that is if you're in independent living and you stay in independent living and then you die and your apartment is vacated, sometimes there might be a language in there about that it has to be rented. So just make sure you read the language and you understand. Don't expect the contract to guarantee a timeline of that refund, right? There's nothing in there that says you're going to get it in 30 days, 60 days, 90 days. Nope. They have a behind the scenes calculation of how they pay it out. So you will get it, guaranteed you will get it, but there's no timeline. So just be prepared for that and don't be surprised. And please feel free to ask them how they figure it out. And they should be able to answer that for you. But just know that you're not going to get an exact timeline. The other thing is you will not receive interest on that refund. So some people are like, well, if I'm giving them the money and they're investing it, how come I don't get the interest back? Nope, you've given it to them. They get the benefit of getting the interest rate, and then you get the benefit of getting your money back. Now, there are contracts, especially type A contracts, that have a non-refundable policy. And some people go, why would I ever do that? Well, the entrance fee in a non-refundable policy is usually lower than a refundable. And sometimes people will say, you know what, I've got my estate planning documents figured out. I don't need that refund. I don't need to pay that higher amount up front. Once again, no right or wrong. You just need to compare and see what's right for you. So I'm getting ready to wind down, and we got plenty of time for Q&A. So tips on navigating the maze. Number one, use the source book. You can get a free publication, as Steve mentioned at the top of the hour, and there is so much information in there that it is a wealth of information and knowledge to help you figure out these different levels of care and what it means. Or you can obviously go online, because you can also see information online. I also recommend that you contact your local area agency on aging. They are very good at explaining the different levels of care and helping navigate the options you may have in your local community, as well as understanding what maybe county resources you can use in addition to some of these things. And lastly, hiring an aging life care manager. I don't know how many of you are new on here, but Steve talks about aging life care managers all the time, and so do I. They really are the consultants of the industry. And, Steve can talk about it at the end and tell you where to get that information, but they're another really good resource to help you figure out what's local to you and what might make the most sense. And when it comes to comparing the costs, that's what I do. So you can call me. I do this day in, day out for families who are trying to compare different CCRCs, type A, type C, or even different apartment sizes. Like, can I afford a 2-bedroom versus a 2-bedroom addendum? I also work with families who are comparing a flat rate memory care versus a fee for service memory care, right? So any kind of comparison when you're looking at any of these stages is something that I can help with. And when I work with families, it's called the Lifecare Affordability Plan. And when I work with families before working with me, they're just confused. Like, I did my best today to explain these contracts, but there's a lot of information. And I've been working now with this for 20 years, right? But after we sit down and after we do this comparison with their real finances and real costs of whatever communities they're looking at, families tend to feel more prepared and they're ready to make a decision because they understand how their financial picture matches up with the different contract types that they're looking at. So those are all my prepared slides. My contact information will be listed somewhere, but I am ready to jump into questions, Steve. You're muted.
Love it. Yep, I love it. And there are a ton of questions, which doesn't surprise either one of us. The other thing, before we start diving into these, is in the audience, I see elder law attorneys. I see people that work in life plan communities. I see aging life care managers, financial planners, folks that have walked down this road before. Use chat and share any and all resources. Don't think of Arvette and I as the be all end all experts in this area. Collectively as a community, we're all experts, and authentic real life stories that you've either dealt with personally or with your clients or what have you can be very helpful. So, so everybody chime in as we kind of go through this in discussion. So, okay, let me, so we've got, I have let's see, I have long-term care for facilities only, and I'm likely to move to a CCRC or a life plan community.
Yep.
Additional support is needed in independent living prior to move to assisted living being necessary. Should my long-term care insurance, okay, she's talking about long-term care.
Yep, I got it.
Okay. Should my long-term care insurance cover that, or is independent living considered outside facilities only? If long-term care insurance doesn't cover, that would make the transition from independent to assisted living less smooth. Okay.
Yeah, no, that's a great question. And we get that all the time. So long-term care insurance policies, every policy can be slightly different. So make sure you read your policy. But in most cases, when you move into a life plan community and you are in independent living, you can bring home care into your independent living apartment, right? Most communities are fine with that. So you either private pay that, or you can use your long-term care insurance policy to bring home care in, right? So that is a choice of whether you move to a higher level of care or bring help in independent. But independent living in and of itself does not qualify for a long-term care insurance reimbursement, because long-term care insurance requires that you need help with 2 ADLs or have some kind of dementia diagnosis. And if you're living an independent, just moving in, you haven't hit that yet. If you hit it, put in a claim, either get home care in your independent living or move to assisted living, whatever you decide with the community that you live in.
And yeah, so there is no insurance that covers independent living, but there are subsidized independent living communities out there, but there's actually quite a lot of them.
Yep.
The thing to remember with anything subsidized, there's gonna be waiting lists, okay?
Yes.
So if you are out there and know somebody that's on a fixed income, get them on the waiting list as soon as possible, because when their name comes up, then they may be ready to move. A lot of times folks are ready to move and they start searching around, and it's like they've got waiting lists for a lot of the independent living.
And that's also true with life plan communities. Like life plan communities have waiting lists, just like the subsidized housing have waiting lists. So it is a really good idea to start looking earlier and just put your name on either list, whatever is appropriate for you.
Okay, Barbara says, is it a good idea to have something like Goodwin living at home, not Goodwin at home, before you go into an independent living community? And so Arvette, if you want to give a brief overview, there's not many programs like Goodwin Living at Home, but I'll add the link in chat while you explain what that program is.
So the at-home programs, they are nationwide. The one that people most know here is Goodwin Living at Home, which was Goodwin House at Home. And in theory, any at-home program around the country was built to support you staying in your home, right? So most of them aren't owned by life plan communities, but in Goodwin House's, Good Living's case, it is. So you have the option to connect with them at your home, and then if you want to move, you can move. It's just another option. And when I'm working with clients, I actually have done comparisons of Goodwin Living at Home versus moving, or Goodwin Living at Home then moving. So it's an option for some people, but not everybody.
Okay, and I'm dropping.
Hope that's helpful. I know that's a tough one.
Yeah,
reach out to the Goodwin Living people.
It is a confusing one. And then I'm also we did have a discussion with a few of these. They call them continuing care at home.
That's at home, yeah, which is misleading a little bit. Yeah,
I'll give you that. I'll add that link in as well. But and also, if your preference is to stay at home, supported, that might work for you prior to making a move to a community. And nobody says that any of us have to move to these communities. But one thing that those of us in the field and those who have lived this realize is, if you want to remain in your home, you've got to do some prior planning and think about this, okay?
Because facts say that 91% of people want to stay home. And there's a whole bunch of us in the industry that want to support you in doing that, right? But you also need to be prepared in case home is no longer an option. And if home is no longer an option, you start doing your research to figure out what your backup plan is.
Yeah, and I'm saying this tongue in cheek, 91% say they want to stay at home, and 91% of those people don't do anything except for say, I want to stay at home. And then when a health care occurs, it's a crisis. Okay, Kylie says, are there specific issues that gay people like myself need to be aware of? Are there some communities that are more gay friendly than others? Kylie, this is a great topic, and inclusivity is something that all communities are very well aware of. But I got a special treat for you, Kylie. In our audience, I saw her. Jennifer Brown is here. She is a leader in the LGBT elder resources. And Jennifer, if you don't mind putting your contact information in there so that Kylie can connect, and that would be fantastic.
Yeah, and there's a bunch of organizations that are active right now all over the country in that space. So Insight Memory Care Center just gave an award to one, which I'm totally blanking on, but Jennifer.
Aging Rainbows.
Yes, Aging Rainbows. Thank you. Aging Rainbows is another one. Yeah, yeah,
okay,
that's correct.
thanks, Jennifer. Okay, great. Okay, Marianne says, how long is short-term nursing and how long is a short-term nursing and rehab stay that would be max covered by insurance, health insurance or Medicare?
Okay, so the one confusion about short-term rehab stay is people think you actually get max number of days. What happens in rehab is it actually determines you have to be progressing in some way, shape, or form in order to continue that skilled stay. So for example, when you're in the hospital, they'll go, oh, you have 100 days. That's true. You can go to the nursing home or to the rehab and start doing your rehab. But if you progress really quickly after 10 days, your stay's over. Or if you get there and you're not progressing, your stay's over. So the rehab community, it's their job to report back to Medicare, Medicaid, your health insurance on your progress. They're only going to pay for you to be in short-term rehab if you are showing some progress. That is why you hear people getting, quote, kicked out of rehab. They're not really getting kicked out of rehab. They just plateaued. And so they either have to transition out of the rehab home or somewhere else, or they have to start paying privately to stay in the building. The people that determine your skillability are the physicians and the staff in the rehab community, not your physicians outside, but the people inside are the ones that are responsible for reporting back to Medicare or your insurance. So I hope that was somewhat helpful.
Excellent. Okay. Let's see. Marianne says, does the monthly fee stay the same in real estate transaction for a higher level of care, like a type A contract? So yeah, is the monthly fee going to move around when you've got this larger entry fee? And
typically when you do a real estate transaction with a life plan community, it operates more like a type C, where it's a fee for service. So you would have to pay more if you move to assisted living. And there's no right or wrong. Like some people will say, I want the tax write-off. Well, if the community that has the purchase doesn't have like the vibe and the activities and stuff you want, it's not worth getting the tax write-off because there's other ways for tax planning, right? So really find the community that you like, and then let's figure out what contract structure they offer that's best for you.
Great. Okay. And let's see. Does the monthly fee stay? Oh, we got that. Okay. Okay. And also, if there's any life plan communities in the audience, feel free to drop in how your fees work and your contact info. And, I mean, we're here to share resources. Okay.
Yep.
Anne says, can you direct your refund to a revocable living trust? And I do see a few elder law attorneys in the audience. So Arvette, do you want to share info on that? But also our elder law attorneys in the audience could help too.
I'm actually not sure. I think that would be a question for the community. I do not know how that would work. In my mind, they probably don't care. They just want the check to go somewhere. But I'm going to defer that to a life plan community that might know the answer about their particular community.
Yeah, I agree. And so communities and elder law attorneys chime in there. But ultimately, if you're researching this or your loved one is researching this, narrow it down to 3 or 4 and have your list of questions. And that's a great question to ask, especially for your estate planning.
Yep.
Okay. Someone would like you to talk a little bit more about the refundable entrance fees.
Okay. So just as a reminder, most communities have a refundable option, and the percentages will vary. Sometimes it's 90%, sometimes it's 80%, sometimes it's a 50%. When they do the pricing structure on those refundables, it's usually a good comparison for people who might have a higher income. So the monthly fee might be higher on a certain option versus people that have more assets. So for example, a 90% refundable, sorry, I'm trying to go off the top of my head. I'm not going to go specifics. In some cases, if you had a job or two jobs, and let's say your guaranteed Social Security and your guaranteed pension is $10,000 a month, you may opt for a contract structure that has a higher monthly fee and a less entrance fee, or a less refundable entrance fee, because you've got that guaranteed money, which might make sense, as opposed to someone whose guaranteed money is maybe only $3,000 a month, and they'll be pulling out a portfolio or whatever. So they may opt for a different contract structure because their cash flow is different. So just be prepared when you're comparing these refundable contracts to not just look at the entrance fee, but you need to understand your particular cash flow to see how close you are to covering the monthly fee without pulling principal from a portfolio, for example.
Great. Okay. And just for everybody, I know there's some questions. People are trying to copy chat because there's so much great information there. The recording and chat will all be on our website this afternoon. Okay. And trying to get through a pile of questions. If you need to jump off early, it's recorded this afternoon. Okay. Wendy says, can you please speak about involuntary discharge clauses in assisted living contracts? So that would be somebody being kicked out for their behavior or something like that.
You know, I actually had a whole slide on that, and I took it out because I was like, it was too much. All right, so that is a great question. Assisted livings are regulated by the state, and they, if you have a resident that is in the assisted living or the memory care that is potentially causing harm to themselves or others, then the leadership within that assisted living can say, we need you to move out, right? Another reason they could say move out is, let's say you go to the hospital and you come back and your care needs are higher than what really an assisted living should be providing. That's another reason they might say you need to leave, because they're putting their license in jeopardy because they're only allowed to do certain things, right? So those are two examples. One is behavior, and another is your criteria and your need is too high. So you have to go up a level, which means you have to go to the nursing level of care because you've exceeded what an assisted living can do from a regulation perspective. And the other thing is finances, honestly. Like if you're in an assisted living and you're not paying your bills, that's the third reason they can ask you to leave.
Okay, great. Now, have you heard of, Holly says, have you heard of communities that have an expiration date on getting a refund? For example, if you're a resident for longer than, say, 10 years, you would not get your money back.
So sometimes I think what you're referring to is what they call a declining balance. So some people have a non-refundable entrance fee, but it also has a declining balance. And that gives you a little buffer that if you move in and something happens and you die within 6 months, you still can get a portion of your entrance fee back. So that's the declining balance entrance fee. 10 years is a little long, but you will hear that sometimes thrown out, declining balance. But most of the times when people are looking at refunds, they're looking at that 90, the 80, the 50 that you don't get back until you die. Or this is the other thing. People talk about, what if I move out? You should not be picking a life plan community if you don't want to be there. Like, don't go in thinking they're going to move out. Like, that's not how that's supposed to work, right?
But you do have choice. I mean,
You do have choice.
Yeah. And also the other thing, I know there's a few communities out there that you get your refund in the agreement. It will say you get your refund when we lease, or when we sell or lease or rent your unit. And
so I said some of them have that and some of them don't.
And that always brings people, geez, well, what incentive do they have to lease that? And I mean, again, these are detailed questions that you can ask your providers. Right. And I would say, Arvette, I know I've had this question quite some time. Do the community, and maybe folks in the audience can share this, do communities ever allow for rewriting of their contract or notes in the contract, special exceptions?
Yeah. The legal people will tell you no. I tell clients all the time, the contract is the contract is the contract. Like when I was working in the industry, I had people always asking me, can I change the contract? No. And then on the finance side, I tell my clients, like, these are their contracts, like it's not going to change. And so if there's something in there that you just can't deal with, then move on, right?
Mhm.
But in most cases, when it comes to, I was gonna say, oh, I wanted to quickly comment on what you said about what incentive do they had to fill the apartment. You have to remember, census is what drives communities. So as soon as someone vacates an apartment, there's a whole bunch of people that are invested in getting that apartment filled. So don't feel like, oh, they're going to leave my apartment empty just so they can keep my money. Nobody's thinking like that.
Yeah,
They're trying to get
they
people
make more
in as fast
money
as they
by
can.
getting
Yep.
somebody in.
They make more money by getting new people in.
Okay. If you have long-term care insurance, which type of contract is best so you can pay for a higher level of care with your insurance?
Right. So your long-term care insurance will work with any of the contracts, right? Because once again, you're allowed to bring care in. And if you look, you have to look at the stipulations within your specific contract, but there are ways to use your long-term care insurance contract in every single one of those communities. Goes back to what's most important is finding a couple of communities that you really like, and then dive into the details about the contract, right?
Steve Jeffries, I knew this one was coming. Life plan or CCRC contracts can be 80+ pages long. What do you recommend to review contracts?
So I've actually been going through this with the client right now. The reality is there really isn't anybody out there. I mean, you can call an attorney, but I mean, I'm not saying the attorneys aren't going to do it, but if you want to pay that much money for an attorney to read it, that's fine. Knowing that nothing's probably going to get changed. Just be realistic, right? So if you want to pay somebody just so you make sure you understand it, that's fine. But I wouldn't go in thinking that you can actually do anything other than what's in the contract.
And let's see, and so I know some elder law attorneys and some attorneys in general, one thing that they can do is they can explain the contract in common language. Okay. And so some people sleep better at night, having the attorney explain or point out certain elements of this contract that you need to be aware of.
Right.
For example, if I'm going to see how this place works for me, then you just know the penalties you might pay if you have to move out in a year. Okay.
Yep.
Let's see. And okay, Steve Jeffries, again, great question, Steve. These come up all the time. Who do you recommend to review the financials of CCRCs or life plan communities? And one thing I'll add on, I want your thoughts on this too, is in the beginning days of life plan communities and CCRCs, there were some of these places that were going out of business because they didn't have actuarial tables attached to the community. I've been in this business for 32 years, and I think only one or two in the early stages of my career did I see change ownership because of that. This is very regulated now by state insurance commissions. So you can ask them for the financials, and you should ask them for the financials. But most of us can sleep well at night knowing that if our loved ones are moving into any of these communities, they're still going to be there 20, 30, 40, 50 years down the road.
And the other thing you can do, you can find out what their bond rating is. I mean, you can look that up and just know that most of them, and I agree, Steve, we've just had this conversation, Tom West, the partner I work for at SEIA, we just had this conversation with a client the other day that most of their bond ratings are right where they're supposed to be. So I would start there.
Great. Okay. We got a pile of questions. It's almost 1 o'clock. We're going to keep on going. Arvette, you're cool with,
yeah, I have a 1:30. So okay. I would like to be
We're
off
not
by
going past 1:30. And if we do, no, we'll at the most, we're going to go 1:15 and we'll get through these questions. Okay. Ann Ritchie says, we have a friend going to, well, I'm going to name the community because they're a positive aging champion, Erickson community. He chose it partly because they guarantee that if you run out of money, you will not be required to move out. Is this a common policy? Are the monthly fees higher to subsidize that for people who need it?
Oh, that's a great question. So one of the benefits of life plan communities is most of them have a foundation or some kind of cushion to provide financial assistance for people who run out of money. Life plans will do a financial analysis before you are allowed to move in. So you have to be financially approved to move in first, because they know that what kind of risk they're willing to take or not take. So you could be reassured if you move into a community that has a foundation or some kind of cushion to cover residents and running money, they do that. It is a real thing and happens all the time. That is different than a standalone assisted living or a standalone nursing home. They don't always have that foundation or that financial assistance.
Great. Okay. Catherine says, what is the refund based on? The cost first bought when you move into the residence?
Right. So the refund is based on the entrance fee from when you first move in. So whatever that entrance fee is when you first reserve, whatever that dollar is, it's the percentage of that dollar. It doesn't change over time.
Okay.
So if you pay $300,000 and you live there for, 10 years, you're going to get the refund on the $300,000.
Okay. Holly asks, in order for a long-term care policies to go into effect, there are many requirements.
Right.
Not only do you need help with 2 or more ADLs, there's usually a number of days you need to be receiving care before it kicks in.
Right. So what you're referring to is the elimination period. So most contracts have an elimination period that's anywhere between 0 and 100 days. So that is true. The key to that, if you have a contract, the best thing you can do as soon as you need help, you need to start a claim, because then it'll start the elimination period. And then the sooner you start the elimination period, the sooner you can get reimbursement. But that is true. Most contracts have an elimination period.
Okay. And here's a question. And again, I know we didn't go deep into your resume there, but the person asked, what about hospice and palliative care? Do they have contracts? How do they work? And I know, Arvette, you have some experience in working in that setting.
Yeah, so hospice is typically covered by Medicare or insurance. Most people aren't aware of that. They think there's some kind of private pay function. So typically covered by your Medicare or Medicaid and insurance. What's not covered is your room and board. So if you are at home on hospice, the services are covered, your durable medical equipment is covered, anything tied to your diagnosis is covered by Medicare insurance. If you are in an assisted living, remember you're already paying private pay to live there because Medicare doesn't cover it. You're paying private pay to live there. If you go on hospice, you still have to pay for the room and board, but the hospice services, your durable medical equipment and all the services will be covered by your insurance or
Great.
Medicare.
Okay, George has a good question. Is there a ballpark fee for assistance with placement, search, and assistance? I have no idea what I'm doing and I don't have a lot of time. And George, here's something, and I'm glad you're bringing this up.
Yeah.
Everybody has to get paid, okay? So, for example, you could, Sourcebook, what I publish, lists all these places. We are supported by our positive aging community champions who you'll see sponsorship messages. That's how I get paid. There are realtors that could help you in this setting. Well, they're going to get a commission if they list or sell your house. They might help you for free of charge, but ideally 10, 20 years down the road, there's going to be a transaction there. But one of the confusing things that's out there is there are these free services that provide placement. But always when something is free, ask them how they get paid, who pays their fees, and how that's done. There's also aging life care managers can help you with this process. In general, the aging life care managers will charge you an hourly rate. But I just like to explain that because I get a lot of questions in this area. And just when you're working with somebody, just clarify where they're getting paid and how they're getting paid. But in this field, there's a lot of people that will help you out. And they might help you out for free and say, I'm helping you with this, but my primary business is this, or what have you.
And I would just add to that, and it's very important to find somebody that knows the local market, because the turnover in some of these communities happens. And so you want someone that's in the local market and they can tell you oh, that community just had a full turnover of staff and what that means. So if you do like an 800 number and you're talking to somebody that lives in Idaho and you live here, like they're not going to know what's happening locally. You should stay local.
Yep. Okay. Martin says, you talk about a refund once you die. What about if you choose to move out of a life plan community or CCRC? Do you get any or all of your entrance fee back? What are the conditions where you would get a refund?
It's the same condition. If you have if you sign up for a 90% refundable, if you move out, you can get 90% back, right? So that's the same thing whether you move out or die. I don't focus on the move out because making a decision to move to a CCRC is something you should, or a life plan committee is you should think through. It's a huge purchase and a huge chunk and a huge change for something that you're not sure about, right? So I always tell clients, when you're moving into a community, you should feel like, oh my God, I'm excited to be here. You shouldn't be going in thinking I might be moving out.
Yeah. And one scenario that I've seen where the move out does occur is, let's say a husband and wife move in together and they're there for a few years, and then one of them passes away and the surviving spouse might say, geez, I really would like to be closer to my kid. Oftentimes, though, we find in that scenario, they have become such a part of the community that going through that grieving process and being there in the community is where they want to stay.
Well, and I'll tell you, I've had examples of clients where they know their spouse has a chronic illness and will not live for a long time. And part of the discussion is, when your spouse dies, where do you want to be? So some people jump into moving into communities like that, but at the end of the day, you have to find where you want to be, and don't try not to make an emergency decision for the both of you. Just take a moment and breathe.
Got
and
it.
there's a lot of people that can help you in this whole world and network.
Oh, Sheila, I'm surprised it took this long for this question to come in. What is the range dollar amount people are paying for these entrance fees?
Oh, it's anywhere. It could be it could be $300,000 to $1 million. Like, it's a huge range. It depends on the community. It depends on the size of living space. It also can depend on the location of the living space within the community. So there's a lot of factors, and it ranges.
Yep. And I just did a quick Google search, and you know what that's like, but something popped up and it said about 300,000. But again, that could
That's
be
way low here. That's way low in
exactly.
Northern Virginia.
Yeah. Okay.
Yeah.
Oh, where do you find bond rating? Anne asks, where do you find bond ratings? You talked about the bond ratings of the
Yeah. I think you online. I'll have to see if we can follow up with that. I don't know the exact place. I just know you can.
Okay. So yeah, you can feel free to reach out to Arvette and or you know, ask the community, do you have a bond rating? And they should be very transparent and share that with you.
Right.
Okay, Tom Demuth says, after narrowing down 2 or 3 communities, does Arvette provide assistance in comparing the long-term care expenses for each community?
Yes, that's exactly what I do.
Okay, great. And then, and also I might add, in December, we are going to be doing a discussion where we spotlight an actual person that used the Lifecare affordability plan and is now living in a life plan community. So I'm super excited about that one.
Yeah. I saw a tax question. I just want to make sure I get to that before I have to jump off.
Absolutely.
Yeah. So someone asked about the tax write-off for assisted living. So it is true that if where you're living has a assisted living or nursing license, right, there is a tax write-off and benefit. So one, what services are you paying for? And then you can use that as towards your medical deduction. It gets a little confusing because sometimes in a life plan community, you'll move into independent living, but the independent living building is actually licensed as an assisted living. So everybody that lives there gets a little bit, even though a little bit of a tax break for the medical deduction, even though they're not getting care themselves. So there's 2 ways to get the tax write-off. You're getting care, so that can go towards your medical deduction, or you live in an independent living that's licensed as an assisted living, and then you get a little, everybody gets a little bit.
Okay.
So I hope that was clear.
Oh, no, that's great. Okay. Nadine says, where do you find information on state health inspections? And that's primarily for the nursing homes.
Yeah, so you can go online you can go on medicare.gov and get so Medicare. So nursing homes, there's kind of two regulation bodies. There's the federal regulation under Medicare, right? And then there's the state regulation board, which is Department of Social Services, maybe. So there's a couple agencies within the state that you can look up. So you can find all kinds of information. All of that information is public.
And
But I also would say, remember, no place is going to be perfect. When people go, there's always going to be something that's not right or whatever. Nobody ever wants to be in a rehab. Not a single person in there wants to be in there, right? So the staff does the best they can to provide the services that they need. But think about it. They're constantly getting pushback from the residents and the families because nobody wants to be there. So look it up, ask the questions. No place is perfect.
And also remember, when they're doing inspections, it's this short window.
Yep.
It's not this ongoing thing. Being an actively involved consumer in the community that you're a part of is, I draw a lot of analogies to college and school. When we drop our kids off at school, we all join the PTA, we get to know the teachers. That's one of the things that you want to do in these settings as well.
Yep.
Okay. Barbara Ryan says, back to long-term care question, wouldn't it make more sense to get a type C contract since you will have money to help for extra care if you need it?
Are you talking about for long-term care insurance?
Or I think actually long-term care, no, she's talking about a life plan type C, saying, would that make more sense to go with a type C contract, which I believe is the contract without the entry fee, correct?
No, they both have entry fees.
Okay.
So type A and type C both have entry fees and they both have monthly fees. The only difference is if you need more help in a type C, you have to pay more money. If you need more help in a type A, it stays where you are. Once again, no right or wrong. This goes back to your philosophy of how do you typically purchase insurance is where I start, but also which community do you like from a vibe perspective? So don't discount a community because of a contract structure. Find the communities first and then figure out how the contract structure can work for you. Because most communities have options.
Got it. Okay. Barbara Rosenthal, we're talking about fees here. What are Arvette's fees and how do we contact her?
All right. So contact me is in the chat, I think. And so just a little background. So typically when you're working with a financial professional, they want you to consolidate all the money and they charge you a percentage of assets. So SCIA as a company, we do that. But I was not brought on board to do that. I was brought on board to actually create a brand new planning tool called the Lifecare Affordability Plan. And what we do is we actually sit down with you and we come up with your scenarios. What communities are you looking about? What healthcare concerns do you have? What life expectancy do you have? Are you a couple? What happens to survivor benefit? Lots of things we go into, health and financial, and put together a plan directly for you. So it's a one-time plan, $4,000 flat rate for whether you're single or a couple. And we go until we finish. It typically takes about 3 months. And when you're done, you get a whole bunch of information, including a full portfolio review. So if you already have your portfolio with a brokerage account like a Charles Schwab or Fidelity or another wealth manager, this process complements that. It doesn't replace it. What we do, you actually give to your other financial professionals so they can better serve you as you make these decisions down the road. Okay,
great. Let's see. Marilyn says, does Arvette recommend anyone in New York City? And Marilyn, you're not alone. I know that it feels like everybody here is the Mid-Atlantic because that's where we're based, but these discussions, we have people from all over the world now.
Yeah.
But
and I work with clients all over the country. In fact, I'm working with 2 women that live in Queens right now. So I know the New York market pretty well. So yes, I have clients all over the country.
And really, reach out to either me or Arvette. We are, as our community is expanding, we're trying our best to connect people in different parts of the country or world where they've got these questions.
Yeah.
Okay.
All right. One more, Steve, and then I'm gonna have to get off so I can prep for this.
No. I think we did as good as we can. this was amazing, and Arvette, you were amazing. You provided a great framework,
Yeah.
but I really want to thank all of you in the audience because and part of our community, because just seeing how you shared resources in chat, and these are fantastic questions. But one thing for sure, we got to do this again. So I'd almost say we need to do this on a monthly or bi-monthly basis. So I will get this recording up. If you had something that you had a question about that didn't get answered, just email Arvette or I, we will take care of it. But check our website this afternoon. I'll have everything there. Arvette, do you have any problems in PDFing your PowerPoint and sending it?
I usually don't share slides because they're out of context,
And,
right?
and also you have financial, okay. So guys, if you want to reference the things that Arvette talked about on her PowerPoint, you can just move the recording and look at them there. But I think we've got most of the documentation here. Thanks so much. Great discussion, and we will talk to you all soon.
Thanks, everyone. Have a good day.
Thank you.
Bye-bye.
Bye.